Do you ever feel a sharp pain in your shoulder when reaching overhead? You might be dealing with shoulder impingement syndrome. In this video, we'll break down everything you need to know, from anatomy to special tests and treatments. Stay tuned. Section 1 Introduction. Shoulder impingement is one of the most common causes of shoulder pain, especially in athletes and people who do repetitive overhead movements. It happens when the tendons or bursa in the shoulder get compressed, leading to pain and inflammation. But what exactly is going on inside your shoulder? Let's take a look. Section 2. Shoulder anatomy. The shoulder is a complex ball-and-socket joint made up of the humerus, scapula, and clavicle. The key structures involved in impingement are bones, humerus, acromion, clavicle, muscles, rotator cuff, supraspinatus, infraspinatus, teres minor, subscapularis, soft tissues, subacromial bursa, ligaments. Impingement happens when the subacromial space narrows, causing compression of these structures. This can lead to pain, weakness, and even rotator cuff tears if left untreated. Section 3. Causes and risk factors. So, who's at risk for shoulder impingement? Primary causes: bone spurs, hooked acromion, thickened coracoacromial ligament. Secondary causes: overuse and poor mechanics, weak rotator cuff muscles, poor posture, rounded shoulders, repetitive overhead movements. It's seen more often in men, especially those involved in overhead sports like swimming, baseball, and tennis. But it can affect anyone. Section 4. Signs and symptoms. How do you know if you have shoulder impingement? Look out for these signs. Common symptoms: pain with overhead movements, pain at night, especially lying on the affected side, weakness in lifting the arm, a painful arc, pain between 60 to 120 degrees of shoulder adduction. Section 5. Examination and special tests. A proper assessment is key. Here are some special tests used to diagnose shoulder impingement. Neer's test. Host passively lifts patient's arm while stabilizing the scapula. Patient winces in pain. If this causes pain, it's a sign of impingement. Hawkins-Kennedy test. Host flexes the patient's arm to 90 degrees and internally rotates it. Patient shows discomfort. This test compresses the rotator cuff tendons and is positive if pain is reproduced. Painful arc test. Patient lifts arm slowly and shows pain between 60 to 120 degrees of abduction. Pain within this range indicates impingement. Drop arm test. Patient tries to slowly lower their arm, but it drops suddenly due to weakness. A positive test suggests a rotator cuff tear or weakness. Section 6. Treatment and outcome measures. Treatment focuses on relieving pain and strengthening the shoulder. Here's what you can do. Exercises and rehab. Posture correction. Avoid rounded shoulders. Strengthening rotator cuff and scapular stabilizers. Stretching tight muscles. Activity modification. Outcome measures. Visual analog scale (VS) for pain assessment. Dash score for disability measurement. Spotty score to track progress. Section 7. Closing and call to action. If you experience persistent shoulder pain, don't ignore it. Early intervention can prevent more serious issues like rotator cuff tears. Try these tests and exercises and let us know your experience in the comments. Like, subscribe, share,